Hello, good afternoon. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Thank you so much and welcome to our weekend open clinic. And this weekend, we're going to talk about fibroids. And we're actually going to answer one pressing question about fibroid. Can fibroids regrow? If you have recently had a fibroid surgery, which we call myomectomy, when you remove the fibroids, can it regrow? And what's actually fibroids? What happens to be the likely thing that might be leading to these fibroids of a thing? And how can fibroid impact your fertility? And especially, in fact, impact the outcome of your pregnancy if you eventually become pregnant. So that's going to be the major focus for our discussion this afternoon. So please, if you intend to participate, which I will strongly encourage you to do so, please hop in. We're going to have about 20 minutes conversation about the fibroids, and I'm going to use this to demonstrate what I'm going to teach. So quickly come in, make yourself comfortable. If today is the first day attending my events, I normally come up about this time on weekends, 3:30 p.m. Eastern Time US, which corresponds to 8:30 p.m. Nigerian time. But on Tuesdays, I come live by 6:30 p.m., which should be 11:30 p.m. Nigerian time. So make sure you click on the subscription button and your notifications so that anytime I come live, you will have opportunity to participate in real time. So we're actually going to start. I think I have about 3 people in the clinic. So here's the deal. As of today, we don't know what leads to fibroid. So generally, despite all the researches, despite all the investigations, despite all the analysis, as of today, no one knows exactly what causes fibroids. However, we noted that it might have some genetic predisposition. So what do I mean by that? If your mom had fibroids, if your sister had fibroids, if fibroid is in your family, possibility you're gonna have it is very high. So it can be familial. Now, we also know that there are some lifestyle that might encourage you to develop fibroid. One of which is consumption of red meat. For some reasons, we noticed that women that consume red meat might have increased risk factor of developing fibroids. Your body weight. When you have excessive body weight beyond what you should have. So when you plug your BMI and your BMI is giving you numbers in the range of overweight or obesity, you can develop fibroid faster. When you're not exercising, you can develop fibroid faster. When you're not eating your fruits and vegetables, you can actually predispose yourself to developing fibroid faster. These are all risk factors. They do not cause fibroids. They are predisposing risk factors. But the bigger question is, where are the locations we can have these fibroids? And who can have these fibroids? Fibroids can only occur in the womb. Now, for some strange reasons, it looks like women from African origin. So either you're African, core African, or African American, or African British, or African Canadian. Once you have the African gene in you, you have a higher risk of developing fibroid. Fibroid will mainly happen during your childbearing age. That's when you will have very high rate of fibroids development. As you tend towards menopause, possibility of fibroid will reduce. So as you get older, as you tend towards the time you will no longer ovulate, the time you will no longer bleed, development of fibroid will reduce. There are principally 3 types of fibroids, 3 major types of fibroids. 2 of them can impact your fertility. The first type is the one that might not likely impact your fertility. It's outside the inside of your womb. It's called subserosal fibroid. Of the 3 types of fibroid, subserosal fibroid is the least that will impact your ability to have your baby. So it's the least that will impact your fertility and the least that will impact the outcome of your pregnancy. Now, beyond the subserosal, we have 2 major types which can occur inside the womb. The first one is intramural fibroid. intramural fibroid is significantly impactful in your fertility, especially if they are bigger than 6 cm. They can impact the likelihood of becoming pregnant, and they can also impact the possibility of having good outcome. The last one is submucosal fibroids. Submucosal fibroid is also inside your womb, so it can also impact your fertility. So I want you to note the 3 major types of fibroids, and the one you should worry about. Subserosal, it's on the outside of the body. Don't worry about it. That one can impact your fertility if it's so big to occlude your tubes. But if you have intramural and submucosal fibroid, then you should worry, especially if they are bigger than 5 cm. We'll advise you generally to remove them. Now, there are different approaches to managing fibroid. Unfortunately, there is no drug that will melt your fibroid away. There is no herbal concussion that will melt your fibroid away. Matter of fact, please be very careful. Any concussion you're taking out there with the claim is going to melt your fibroid, is going to give you relief. There is no such thing. In medical practice, there are some drugs we can give you to shrink the size of your fibroid pending when we will go for surgery. There are other newer approaches in managing fibroid. But if you want to have a baby, the best approach in managing fibroid is to go for myomectomy. Myomectomy is the surgical removal of your fibroid. There are 3 different ways you can go for myomectomy. You can go through the abdomen, you can go through laparoscopy, or you can use other newer approaches to remove the fibroid. Whichever one that will work for you will be dependent on your unique situation and your doctor and the availability. Now, what I'm going to discuss now is the possibility of the fibroid regrowing. So when we remove fibroids, can it regrow? The answer is no. Once you have removed a particular fibroid, it's gone permanently. However, because fibroids can occur in different sizes, and because the general aim of myomectomy is to remove only the fibroids, we don't want to cause any damage, because the female reproductive system, you can see how beautiful this system is. It's very sensitive. So when we have a need to go for myomectomy, we must conduct a special type of myomectomy called fertility sparing myomectomy. Fertility sparing myomectomy simply means when we gain access to your womb, we will target only the fibroids. We are not going to damage the vagina. We are not going to damage the cervix. Of course, we're not going to damage the womb. We're not going to damage the tubes. And of course, we're not going to damage the ovaries. We are going to preserve your fertility. All the structures I mentioned are the components of the female reproductive system. So we're going to keep it intact. Now, the problem is fibroids can occur in different sizes. The type of size that will warrant removal that will not affect the nature of your womb is the moderately big one and the big ones. So if you have like 12 cm fibroid, definitely we're going to remove it. If you have 8 cm fibroid, definitely we're going to remove it. If you have 6 cm fibroid, definitely we're going to remove it. There are some women that subsequent to removing their fibroids, they will not even believe all the stuff will bring outside their body. Some women can have up to 20 seedlings in different sizes. So here's the problem. When we remove the big ones, over time, in some years, in some women, unfortunately, the smaller ones we left behind because we didn't want to damage the mucosa, we didn't want to damage the surface of the womb, will start getting big. So once you remove the big ones, they will go permanently. They cannot regrow. So the reason why women will subsequently down the lane begin to complain about another fibroid is because while we were trying to preserve the nature of your womb, the inside of your womb, we didn't want to breach the layers. So we left the smaller ones behind. Over time, because of those risk factors, because of a couple of lifestyle modifications, those smaller ones will now start getting big. For example, you might have gone for your myomectomy last 2 years. And in course of going for your myomectomy, we dealt with the 12 cm, 10 cm, 8 cm, 6 cm, 5 cm. But we didn't deal with the 1 cms. We didn't deal with the 2 cms. Then over time, down the road, 2 years, 3 years, the 2 cm and a couple of other new fibroids developed. Unfortunately, we have some women that have gone back to repeat myomectomy. So when you have diagnosis of fibroid, it's important we classify your fibroid. it's important we know exactly the size of your fibroid. It's important we know the symptoms. So the treatment of fibroid will be based on the location, the size, and the symptoms. There are some women that will have very okay fibroids, no clinical correlation. They are just quiet, especially if you're tending towards menopause, because as you're getting older, possibility that the estrogen will be reducing, it's there. And when the estrogen is reducing, the possibility the fibroid will be getting big is no longer there. So the older you are, the likelihood that your fibroid will shrink. So if you have fibroid, if we notice you have fibroid by age 47, we're not necessarily going to be so eager to go and start operating on you unless you're planning to go for IVF and we discover 12 cm, 10 cm, 8 cm fibroid. We'll definitely have to remove it, especially if it's inside your womb. But once you're 47, 48 and your fibroid is not giving you anything, we're going to leave it alone. Now, temporarily, we can give you some painkillers. Some people, we can give some pills. But the only option for women that want to start their family regarding fibroid is to go for myomectomy. And please, if you're going for myomectomy, make sure the person conducting the surgery is experienced, because sometimes women might have okay body. Now, after the surgery, they can develop a lot of complications. So we don't want you developing extensive adhesions, which can lead to a condition we call Asherman syndrome or uterine synechia following the removal of those fibroids. So please be careful. The only person that should manage your fibroid is a gynecologist. Please don't take those herbs. There is no evidence-based proven herbs that will help you medically. It doesn't exist. Whenever you're taking any herbs recommended by anybody out there, you are most likely taking poison. I'm just telling you this. The choice of what you want to do is up to you. There is no herb out there that can cure your fibroid, that will melt your fibroid. It doesn't exist. Unfortunately, there is also no particular medical drug we can give you and your fibroids will melt away. Anybody selling you those stuff, they are deceiving you. Don't go there. Consult with your gynecologist. We will classify your fibroid and we treat your fibroid on individual basis. If your fibroid is not going to stop your pregnancy, then we're going to let it be. If we need to give you some drugs, then we're going to give you some drugs. But if you have to go for surgery, go for surgery. The earlier you go for surgery, the better. Some women will be fighting the myomectomy process until the fibroid is so bad that the only option left for you is to remove your womb. The permanent way we can stop reoccurrence of fibroid is to go for hysterectomy. Hysterectomy means we are going to remove your womb. Once we remove your womb, then there will no longer be an area for fibroid to develop. But if you want to have your family, then hysterectomy is not your option, because once we remove your womb, you cannot carry your baby biologically. You can still go for surrogacy, but once we go from hysterectomy, your womb is gone, and your womb is gone, and you won't carry your baby. So those are my few presentations. I'm going to open the clinic now to give you an opportunity to ask your questions. So please start asking your questions. I see we have a full house. Admin is fully in attendance. So admin, please, if you wouldn't mind, each person can ask me 2 questions. So start asking your questions, please. Dr. Ndiche, I can also recognize you. Thank you for coming. The clinic is open now for your questions. So if you have any questions regarding fibroids, if you want to become pregnant, if you want to become a mother, and we told you you have fibroids, we need to deal with your fibroids first. Until we've dealt with your fibroids, you have not succeeded. Now, some women will not deal with their fibroids and they will become pregnant with fibroid. It's very, very painful thing to happen to you. Pregnancy is already very stressful. You do not want to become pregnant with a pregnancy that will have a lot of complications, including miscarriage. You don't want that to happen to you. So please, let's deal with all our fibroids before becoming pregnant. There is nothing to be afraid of regarding myomectomy. Myomectomy is the simplest surgical process you can go for out there. So please start asking your questions. We have less than 6 minutes to ask questions, so ask your questions so we can go. Okay, COO. Are there foods that increase the likelihood of having fibroids? Yes, red meat. Notorious among all of them is red meat. Now, of course, any food that will lead you to increase your body weight will also indirectly affect your ability to become a fibroid patient. So avoid red meat. Red meat is a big culprit. Avoid any food that will have a lot of contents of calories that will make you to add body weight, because when you add a lot of body weight, is also a risk factor to developing fibroids. So red meat is the chief among them. You have to avoid your red meat by all means possible. Personally, go for plant-based protein. Anytime you want to derive your protein, target plant-based in lieu of animal-based protein. Like I told you guys, up to today, we don't know the exact thing that leads to fibroid, but we know that women that consume more red meat tend to develop fibroid more. I love that question. Does heavy bleeding during menses, is it a sign of fibroid? That's actually a classical presentation of fibroids. And I'm going to mention a couple of other things that will present as fibroids. You notice that your period will suddenly start being very heavy. Matter of fact, not just being heavy, you're going to be bleeding in clots. Previously, you used to bleed for 3 days. Lately, you're bleeding for 7 days. Some days you bleed up to 8 days, and they come out very heavy, and they come out in clots. Pain during lovemaking, excruciating pain during your bleeding. Previously, just minimal pain you can manage, but suddenly you've noticed that you're bleeding more. It's more painful. During your bleeding, you have dysmenorrhea. During your lovemaking, you have dyspareunia. When you want to urinate, you have pain. When you want to defecate, you have pain. You're bloated. You're moody. Your belly is swollen. Those are classical presentations of fibroids. So anytime you have fibroid in your body, they can present any which way, but these are the commoner ones. Yes, some components of fibroid for some strange reasons can be hereditary. So it can be familial, like I mentioned. If your mom had fibroids or your sisters had fibroids, possibility you're going to develop fibroid is very high. So it's familial. So there's a genetic hereditary component of fibroid. Poorly understood, but we have that connection there. Correct. Fibroids can lead to anemia. That's a very important question from COO. Now, what's the pathway of fibroid leading to anemia? Remember, because of that fibroid, which ordinarily is a stranger. So imagine just waking up in your bed. Suddenly you see a big elephant occupying the biggest space in your bed. Are you going to have a comfortable sleep? No. And unfortunately, when you have all these fibroids, they consume a lot of blood. They are blood suckers, so they will consume the blood that your body ordinarily should be making. Meanwhile, by default, every woman every month loses a lot of blood during your menses. So imagine losing more. So one of the classical presentations of women that have fibroid is possibility of developing anemia. So anemia or blood loss. So the more blood you lose, the more you're likely going to lose your hemoglobin. So when your hemoglobin is low, you develop anemia. So you're going to develop blood loss anemia. So the answer is yes. Very, very solid, important question by COO. Okay, is fibroid commoner with older women? It's actually fewer. So you have the highest potentials of developing fibroid in your 20s. As you're getting older, as the level of your estrogen is reducing, the possibility of developing fibroid will reduce. When you get to menopause, practically majority of women that enter menopause will not have fibroid. So as you're getting older, because of shorter supply of estrogen, it will start shrinking. So you have more probability of developing fibroid younger compared to being older. Old age is kind of protective. Okay? Can fibroid grow outside the womb like endometriosis? No. Everything about fibroid is located in your womb. So the classification has to be subserosal, submucosal, or intramural fibroid. Now, when we talk about endometriosis, of course, you know, is when the cells that cover your womb, which is called the endometrium, is seen elsewhere. So you can have endometrial cells in the ovaries, in the tubes, in the omentum, in the abdomen, in the umbilical cord, and they will begin to give you problems. But in fibroid, it has to be in any of the 3 locations I've mentioned. Inside your womb, intramural, submucosal, or outside your womb, subserosal fibroid. So we don't have ectopic fibroid per se. But I love that question. Very technical. Okay? Do we have any other question? We have just 1 minute before I go. 1 more minute, then we adjourn for today. Remember to join me immediately in our Facebook. Remember the big event coming up on the 29th. We have a combined masterclass. The combined masterclass will help you to defeat infertility. If you are currently experiencing infertility, if you're currently experiencing delays, you haven't started your family, you're not pregnant, you're not happy, and 2023 is about to end, come let's fellowship on the 29th, 9 p.m. Nigerian time. We're going to have about 3 hours conversation, and by the special grace of God, we're going to give you the tips you need to follow. And if you follow them, you're going to overcome. Your infertility is temporal, okay? So make sure you join us on our Facebook. And I think that's just about it for today. So thank you guys for coming. That's a full house, and the questions are amazing. So please join admin, and we're going to continue the conversation in our Facebook. But I truly appreciate you guys for coming this evening. Let me see if I attended to all questions. Okay? Pretty much I did justice to all the questions. So thank you for coming. I'll see you guys in Facebook. Until I see you, God bless you and bye-bye.